እንኳን ለስምንተኛው የሀገር አቀፍ የህብረተሰብ ጤና ሳምንት አደረሳችሁ።
Jambo, karibuni kwenye makutano yetu ya miaka 8 ya wiki ya taifa ya afya ya umma.
مرحبا بكم في الاحتفال الثامن بالأسبوع الوطني للصحة العامة.
Bienvenue à notre 8e célébration de la Semaine nationale de la santé publique.
kusoo dhawaada xafladda sideedaad ee toddobaadka caafimaadka dadweynaha qaranka.
Oyei malamu na fete na biso ya 8e semaine ya santé publique.
So I work a lot on public health. So the public health give you meaning there because there are a lot of gaps on the service, but here we don't see much of the things. So let's come to our today topic. Our today topic is very familiar to most of you. It's about adolescent health. So why it's very important? Because adolescence is a type of age or part of event that we all pass in. Just you are born, you are a child, then you are adolescent, then you become adult. From adult, then you are old person or middle-aged person like me. Just lose your hair and become old. So in all these time events, there are different things that happen in our life. In adolescence is a period of development that usually extend from 10 to 19 years of age. The great majority of adolescents are therefore included in this definition. And if you see why adolescence is important, because there are certain reasons that studying the adolescence health is very important, because over 1.5 million adolescents and young adults aged 10 to 24 years die in 2020, nearly 5,000 every day. So this number is not very simple. 5,000 adolescents are dying every day due to something that's preventable, due to something that if we do right action, we can just stop dying from that. So young adolescents aged 10 to 14 years have the lowest risk of death of all age group. In comparison to other age group, those who are 10 to 14 years have the lowest. Injuries are the commonest cause of death on adolescents. When we say injury, it includes traffic injury, drowning, violence, self-harm. Maternal conditions are the leading cause of death among adolescents and the young adults. So injuries are very important to us, because we every time hear that gun violence everywhere in our neighborhood and in our community. We know that's like at least one per year we hear that somebody died because of injuries that's related either to car accident or gun violence. So early onset of substance use also associated with high rate of developing dependence and other problems during adult life. And globally, there were around 41 births per 1,000 girls. So these are like the key facts. Just I'm summarizing those key statistics. It's a number, but that's why talking about adolescence health, especially in public health, is very important. So when we are talking about adolescence health, we are just measuring the burden. What are the most common cause of adolescence health problem? We are not talking about the good thing, but the bad thing. We are measuring usually health not on good things, but on the bad things. So what are those 10 biggest teen health risks? The first one is automobile accident. As I mentioned, when we are adolescent, it is the time of this is the period of the time that we are exercising driving, and we do have our permit and our family control, but still it is a time that we need our own autonomy and privacy. So start driving. So it's just logical that automobile accident is the predominant cause of injuries and deaths in this age group. So inexperience is one of the main problem in automobile accident because we don't have experience. It's just a skill. If you, like typing, when you are typing, the first time you start typing, your speed is very slow. But it is a skill you develop over time. The same thing happened driving. It is a skill. It's not like going to school and learning facts so that on the second day you will master it. It's not like that. It is something that we develop repeatedly. That's what we call a skill. Like if you are a handyman and now, or a carpenter, know how to fix it, you need experience. Or for typing or for whatever, anything that needs skills means it needs repeated action. So if you are inexperienced or the negative part of that, then it will result in accidents. So inexperience is one of the reasons. The other thing is like sometimes we feel like when we are driving car, we don't know our speed, especially because of lack of experience. We don't think that the car is moving because nowadays the cars are very comfortable. We lock the windows and everything. We don't know our speed. And sometimes we say that, oh, you know, I drove like at a speed of 100 miles per hour. We make it fun. So that makes susceptible to automobile accidents. The other reason why automobile accidents is very common on this age group is sometimes people drive when they are under influence. DUI, driving under influence, is a common reason. Why? Why it's called driving under influence? Because if you, for example, are intoxicated with drug or alcohol, that means your judgment is impaired. That's the whole thing. Your judgment is impaired. If your judgment is impaired, that means you are doing something that you will not do without that thing. Like you may pass traffic light, for example, if you are intoxicated, because your judgment is impaired. You may speed. You may not control even the wheel very well. That's the judgment. That's what we don't usually understand. So driving under influence is one reason that people usually go to automobile accidents. So why is very important to us? Why we are talking about this? Because it is the period of time now we are in, especially the audience who are now in adolescence age, that you have to listen very carefully. How many of your family members or your friend that you know that has got already tickets when they are in adolescence age group, where they are only driving with permits, or they hit the other car without having maybe driving license, or without covered by insurance, or without the knowledge of our family members. So we have to know, we have to have the knowledge, and then we have to have a mechanism to prevent this thing not happening. I know it's very difficult. It's very difficult, especially when we are practicing. I'm a father, I have children. Actually, I raised one child, now he's a good driver, but I've been struggling with him to make him a good driver. Still, sometimes when he's driving from one city to another city, I have to call him and say, hey, do you arrive safely? Yes. So it's just precaution, because public health is more of about prevention. It's about promotion of good things and preventing bad things. That's all about public health generally. So that's why we are talking about that. So the second risk factor in this age group is usually we call suicide. I know most of the attendants here are Muslim, and we don't think that a Muslim man or Muslim girl can make suicide, but that's mistaken. That's mistaken. Suicide is something that happens to everybody. So it's something that have a warning sign, and if you know this warning sign, that you can prevent it. How you can prevent it? By just talking, first by talking the symptoms, second by just knowing the helplines. So it's just feeling a burden. Some of the symptoms is being isolated, increasing anxiety, feeling trapped or unbearable pain, increased substance use. You know, these are like some of the signs of depressions. When teens are depressed, because this is the age that all the physiological, social, and all kind of system in our body is changing very fastly. It's very easy for a teen to go to mental health problem and commit suicide than even adults. So we have to know these symptoms. Extreme mood or extreme swinging of the mood is one of the signs. So when we see those signs, I think we have to contact our primary care provider, or we have to talk to our family member, or we have to talk even to our friends or somebody that can just give us help. We shouldn't wait until the final stage people tried to commit suicide. Sometimes it's suicidal thought. It's only just thought that disturb you. Why you are living here? Just it's worth dying. It's not worth living in this planet. When you have that kind of thought, it's better to seek help. Tell to somebody that even help you. Even somebody that you hate. Talk to him. Tell him that I feel these things. It's better to say something to somebody than just keeping to yourself, and finally we go to a point that where there is no point of return. Again, you can just, I think some of us, we can just even mention some people, somebody that we know that already committed suicide in our community, or just somebody who's near to us, or family member or friends. So that's it's just a challenge that is existing nowadays. So far we talked about injuries, suicide. So the third thing is about the gun violence. So I don't know what can I say about gun violence. Very common things, especially in the United States. When we are talking about gun violence, we are not talking about war. We are not talking about community violence. But the gun violence that's happening here is just usually that's done by individuals or by groups. And teens are exposed to gun violence in a different way, in a community, at household, and in the school. This is the day-to-day experience in America. So what we do is, usually, I think it's better to limit news coverage of traumatic events. It's very traumatic. When you see that children are killed, we should just limit that news. Listen to your child concern when there is gun violence around the area. So you have to listen to our children, what they are thinking. Try to put their fear into proportion to the real risk, which is very small. You heard gun violence maybe in Portland. It doesn't necessarily mean that it will happen in Lewiston and let's come to where you live in Lewiston. No, the overall risk is very small. But if it happens, that small risk, then it's lethal. The outcome is very bad. There are a lot of things that the overall risk is very small, but we have to be very cautious, because if it happens, it's lethal. It's a killer. Like the probability of getting cyanide toxin is very low. But everywhere that you see cyanide toxin, there is a mark. It's very dangerous, because once you are exposed to cyanide, you'll never come back. You'll die. It's very lethal toxin. So gun violence is the same thing. The probability of that getting gun violence to you in the general population can be very small, because the risk is associated with a lot of factors. But when it happens, it's very little. That's why we are talking it. So the best thing is to reassure your team that adults are doing everything they can to make their school, home, and the neighborhood safe. So these are the 3 places that I mentioned. There are police and there are community members who protect usually teens. But nowadays we don't control the news, the social medias, what our teens are exposed to. It's not under our control. So it's better to be open rather than saying don't fear, but you have to talk openly about them. If we see sign of those things, then we have to consult to our mental health provider or other PCPs, or even to families and the friends all the times. This is one of the things that adolescents usually are exposed, and this also can happen at home, at school, and in the community. So what are signs that your teen may be experiencing bullying? That means the child may come home with unexplained cuts, bruise, or scratch, or just they may make excuse to avoid the school, or resisting going to school, or riding the school bus. Or they may complain, something that's frequent headaches, or they may lie about even their symptom to you. So you shouldn't say that, oh, this child is resisting school for no reason, but we have to just calm ourselves, our own anxiety first, and listen to our teens, listen to our children. They have sometimes, they may just bullied by some person that they think is their close friend. Sometimes it happens. It usually happens. So losing interest in schoolwork, or suddenly doing poorly in school, appearing sad, moody, teary, anxious, or depressed when they come home from school. These are some of the signs of bullying in the school. So what can we do? Recognizing it. Once we recognize it, then we have to take action. If it happens in the school, we have to just advocate for our child. Even if it's not our child, we have to advocate any child that's just suffering from bullying, because it affects all the performance. It leads to mental health issues. Sometimes it's a cause of sometimes suicides. I mentioned suicide is a leading cause of deaths. So it's very important to know the warning signs of bullying. So the other slide is next. Is tobacco use. So tobacco is one of highly addictive substance, especially nicotine. Nicotine is one of the highly addictive substance. In the past, tobacco was just consumed in a different way. Nowadays, children are telling you that they are vaping, the electronic cigarette, whatever you call it. It's just a tobacco is tobacco. As far as it contains nicotine, it's carrying all the risks that tobacco contains. Don't be cheated by the commercial that is telling you that electronic cigarette is safer than the other cigarette. Nicotine is a substance that makes you to be addicted. What addiction means? Craving for that substance, craving to get that substance in order to satisfy you. Then you end up with that. Why tobacco use is concerning us? If you start using tobacco on a teenage age, by the time you are 40 or 15, depending on the amount they are using, then you will develop what we call chronic obstructive pulmonary disease, COPD. Probably you have seen a lot of people carrying oxygen machine on their back, walking in the community. Probably Houston is a small city, but if you go to big cities around the beach, you will see people of around my age who are 50s already who cannot breathe properly because they have been smoking for a long time and their lung is out of function. So they should be supported by carrying oxygen. Then finally, what will happen? The lung, they just need lung transplant. And do you think that there are a lot of donors for lung transplant? No. Even if you are given lung, you will not survive for more than 3 to 5 years. The best outcome. So which one is the best? Getting lung transplant when you are 50 or stopping not to smoke when you are 15 from the beginning? You will get COPD in 15 years of age, but if you stop at the age of 15, you will not get that. So that's the importance of knowing public health things. Stopping tobacco use is one way to stop COPD. The other way is lung cancer. Lung cancer is the #1 cause of all deaths of cancer. It's the #1. Cancer is #1 cause of death. The second cause of death in this country, second to heart disease. So what causes those cancers? Cigarette or tobacco is #1 risk factor for all kinds of cancer, especially lung cancer. All men and the women are dying now because of lung cancer. Cancer is #1 is lung cancer. Why? In America, during the baby boom around 1960s, just smoking cigarettes was just a fashion. And those people who are born now, most of them, either they are carrying oxygen machine or they have been diagnosed with lung cancer because of smoking. What's the level of risk? I cannot tell. Let me tell you, if you smoke 1 packet of cigarette, 1 pack a day for 20 years, the risk of getting lung cancer is almost 50%. 50, half. If 100 people start, 50 of them get lung cancer. 50 of them get COPD. Nobody's left without any problem. Those who are left, they will die also with heart problem. So at the end of the day, if you just, they call it pack year. The number of cigarettes you smoke per day matters. And for how long do you smoke? Especially, we usually count 20 years. Once you know the risk and you stop smoking, so your body republish itself. Or like if you just quit smoking for 10 years, some of the damage that you caused come back, but not if you already developed cancer. So usually the median age people develop lung cancer is around 15 years old. They start when they are 15 or 20 years old, or 19 or 18. So by the time they're in the middle age, they already developed this chronic disease. Either it's cancer or heart disease or chronic obstructive pulmonary disease or lung diseases. So tobacco use is very important. Tobacco's effect is very important for the teenagers to know it, and to even educate their parents if they are smoking, to tell them the information. What's next? So alcohol is another risk factor. Previously, we talked about driving under influence. Teen and alcohol are related on that condition, but alcohol is a depressant. It's not something that makes you happy. It's something that makes you sleepy. How do you learn? Usually, peer effect, parent effect. Some of the kids may be born from alcohol drinking family, so they are exposed at early age. Especially when children are exposed to alcohol, when mom is pregnant, then they will develop what they call fetal alcohol syndrome. So they have a lot of manifestation, which is not part of this coverage. But the National Institute on Alcohol Abuse and Alcoholism advise keeping the lines of communication open and emphasizing some key points, including alcohol is a depressant that slows the body and the mind. So being under the influence of alcohol impairs judgment. That's what we already talked. So if your judgment is impaired, you do everything, all unwanted things, not only driving, you do all unwanted things. You are not only fighting with your parents or your friends, you do everything that's evil, because it's because of our judgment that we are doing right thing right. Once our judgment is impaired, we do all evil things. We think that we are doing right, but we are doing everything that we are doing is evil. And on next day, on the other day, when we just memorize that, then we'll get depressed. Some people even commit suicide because when they memorize what evil thing they did, they feel guilty, and just feeling guilty repeatedly leads you to suicide.
Rishi, some of the questions that we kind of came up with in our break room was, what are some resources for youth to kind of explore these topics that you talked about if they don't feel comfortable about reaching out to their parents or mentors that are in their life? What are some resources that they can seek or use to research about these things?
Okay. Another question? That's the only question?
Oh, do you want me to ask all of the questions? So
yeah, so that I can answer one by one.
Yes. The second question goes kind of along the same line of question, but directed towards parents. So what are resources that parents and mentors can use to help them be better communicators with their youth in their life, to talk about some of the difficult subjects? How can they be better communicators? And then the third question is, what are the best way to reach youth and parents?
But generally, if you want to read about adolescence, risk factors and everything, I think CDC and the WHO websites are the best site. I usually refer those things. If you want to study about adolescence health, what is the implication, what are the risk factors, not the detail, not the science, but some good information are there in CDC's and the WHO websites. And nowadays, we don't have issue with resource if you know the topics. You know, I usually go to Google and see what's written about those, unless I'm writing, you know, peer-reviewed articles or for academic purposes. So for general information, for consumptions, so Google is the best teacher nowadays, especially on these topics: adolescence health, adolescence risk factors, health risk factors, all those things. If you want just like alcoholism or violence or injuries in numbers and in science, and also just CDC is also a good site. They have a good document there for especially adolescents who are most likely from middle school to high schoolers. Can also just, they can access very easily and usually in English, and there is no problem in communication with that. So resource for parents, usually most of our adolescents here, we are concerned are immigrants, and we have a lot of immigrant resource center here in Houston. New Manor is one of the immigrant resource center. Mercy is one of the other factors. You know, to get basic things, like basic things, the culturally appropriate advices. Culturally, I'm not sending go to the Trinity Church or somewhere. No, I'm talking about culturally appropriate resource centers. So New Manor, I'm not advocating for New Manor, but I know that they have a lot of resource being there for a long time with these communities. So you can get a lot of resource there for parents, especially. Our mosque and our churches, there are a lot of immigrants who are also Christians. They are also our people. So they have like, we do have like some congregation here, Congolese. We have 2 mosques here. It's a good resource, by the way, for parents and children, especially if you contact Sheikh Salah and his group and Sheikh Abdul Qadir and his group in the other mosque. They have a lot of resources, especially on child disciplining, you know, just to avoid those things, to give you like basic knowledge about adolescence risk factor. I said it here in English, probably they may tell you there in Somali, but the whole thing, the content is the same. The content is just preventing harm for adolescents. We are preventing harm for adolescents. So we are just dealing about prevention. That's why we are celebrating today Public Health Awareness Day. So it's about prevention. So I think mosques are the good resource center also for parents besides organization. What is the best way to reach users? The best way, I think Muhammad is here. I can see him. He can answer that question for me. Is one of a good adolescent who is also a community health worker for New Manor. So
I was in group 3 with Habib, Rian, and Asha, and we talked a little bit about like the health effects of like drinking and smoking at an early age, especially like with pregnancy, because how like Dr. She talked about, and we spoke about how like peer pressure can cause like people to like, you know, get into the bad habits of like drinking and smoking and stuff like that. And we talked about like ways to like prevent it, such as like distancing yourself from like those group of people, making excuses to like not hang out with them when they ask to hang out. And we also talked about how like drinking and smoking can cause like it can shorten your lifespan and like dying at an early age, and it can also cause like future health problems like cancer. So yeah.
The other thing is recreational drug. Here, I call it recreational drug. It's the way it's my source, but it's not recreational drug. There is nothing, drug and recreation is not going together. There is no what we call recreational drug at all, okay? It's a misleading term, but I purposely used it. So don't say to me, I use recreational drug. No, drug is drug. There is nothing about recreation. What you will get finally is dependency, addiction, and the days. That's the outcome. Are adolescents at risk? Yes, they are number 1 risk in a different way. 1, in using the drugs or in selling the drugs. You know, some of the kids probably may come from a big family, or the parents have limited income. Or even if you come from one single family, the parents and the child relation is very small, may be limited, because parents usually stay at work 24/7. Then the children are exposed to the environment where selling drug is a source of income. So you just experiment it. You try your first thing to sell, and you get 10 bucks. Oh, I got 10 bucks yesterday. This is how you start things very easily. I'm not saying group A or group B or group C is at risk. Everybody is at risk. So selling and using both are risk for you guys, and it will affect your adult life at all time. It's a common things. Overdose, you may have also heard like people dying on accident, people dying on overdose, people dying on suicide. We can count. Whatever reason we give, you may say that, oh, somebody else cheated him and they gave him, this is small dose and he died. Never does that matter. So what matters is that using drug, there is no any safe just about using drug. There is no any safe way of using drugs at all. Handling, transporting, selling, associated with it, nothing, all of them. It is something that we have to avoid from the very beginning. Because the risk, the consequence may follow throughout our life. It may be even generational. It may affect our children, our grandchildren. Have you ever heard like intergenerational poverty, intergenerational alcoholism, intergenerational drug addiction? One family passed to another family. If my family drug addict, my kids grow up with that environment, and they think that using drugs is appropriate, and it's okay. That's why at early age, our brain cut whatever we see. Yes, we are learning from what's going in our house. So we think that that's normal, and may just marry somebody also who is addicted with drug, then we'll have a child. So the things will go from a child to grandchildren. So that's what we call intergenerational drug addiction, intergenerational dependency, intergenerational alcoholism. And then it has our own risks, then intergenerational poverty. All these things are related. Poverty is not coming simply from the sky or because you are cursed or you are something. Sometimes it's just our own choice, which is a very wrong choice at the early age childhood that lead us to intergenerational poverty, because we are a country of opportunity. If you don't use this opportunity at the early age, then you may miss, you may miss, and finally end up with this intergenerational poverty. So the last two slides is about something that's related with nutrition, eating disorder and obesity. Eating disorder especially is very common things. It's usually happens to have different parts, but I'm telling you those, the bulimia nervosa, the bulimia type, just because it's very common in girls, especially. I'm not finger pointing to girls, but it's very common on girls than boys. And usually what they do is they see usually, picture of these celebrities, skinny people or whatever they are, and they develop this mental setup to look like them. So what they do is usually they eat food and then they throw up. They go frequently to bathroom and throw up. And some of them may end up in bulimia nervosa, in hospitalization and even death. So it's one of the things that parents and children need to know from the early childhood. The last kind of nutritional problem is obesity, excessive weight. Obesity is very common, especially in the United States nowadays. I think I don't know the prevalence or the epidemiology or the magnitude, but it's very, very common, especially childhood obesity is getting very common. Why it's very important? Because obesity leads to a lot of things. It leads to what? To mental, physical, and the social problem. Like what are health problems associated with obesity? Sleep problem, heart diseases, diabetes, joint diseases, kidney diseases, all kind of diseases that we know is associated with obesity. Mentally, low self-esteem, depression, and a lot of things. So why it's important to know? because it's something that we prevent. Is it preventable? Yes, most of it. How it affects adolescents? It just affects because of the environment that we are living in, starting from our house to the communities and to our choice, not inactive. Like I can be just, children can be obese very easily nowadays because if they are on electronics all the day, just watching, playing a game, or just watching a movie, or playing on your phone the whole day, then you become inactive and eating this fast food. When you are in a game, you don't know what you are eating. You don't control it. Then you can easily develop obesity. Being active is one way of just preventing obesity. Yeah, I think most of the adolescents know how to not become obese, but still, if we see an obese child in our community, we have to take it. Just like everybody's obese. I'm overweight. I myself, I'm overweight. I'm 15. But is this okay? No. I have to just work hard to overcome against my weight because it's not healthy. So some of the unhealthy choice leads to us not to be healthy. Obesity is one factor. Obesity and lung disease are associated. Obesity and diabetes mellitus, especially diabetes now in the adolescent age, is associated with obesity.